These lectures are not designed for use as medical references to diagnose, treat, or prevent medical or mental health illnesses or trauma. If you have questions about the diagnosis, treatment, or prevention of a medical condition or mental illness, you should consult your personal physician or other mental health professional.
There's a Japanese art called kintsugi. Literally translated, this means golden repair. But it's much more than that. Kintsugi is a philosophy of repairing broken things, like cracks in pottery, for example. Rather than hide an item's imperfections, the reparation process highlights them. Those imperfections are considered part of the item's history, and repairing it this way can add beauty to the original items, like using precious metal to fix cracks in pottery. We all have our cracks and scars. We wear our lives, our histories, on both our bodies and within our minds. We've loved and lost. We've won, we've failed, and we've all struggled with how to make meaning out of it. These days, we hear more and more about traumas, sometimes from many years ago, sexual abuse, sexual harassment, physical violence. We hear more about income inequality, poverty, homelessness. It's easy to feel discouraged. But my hope is that this increased visibility, this pushback against keeping secrets and feeling shame, is a necessary step for healing. It brings us closer to justice, but it also gives us a more nuanced and insightful explanation for why people do the things they do. And here I'm talking about the victims. The trauma may end, but the effects continue, sometimes for a lifetime. And how do we get from damage to repair, or even to what's called post-traumatic growth? Let me introduce an important and relatively new area of research that's caused quite a stir in the medical and mental health community. It's called the ACEs study. What is an ACE? ACEs, or Adverse Childhood Experiences, is the term given to describe all types of abuse, neglect, and other traumatic experiences that occur to individuals under the age of 18. The landmark Kaiser ACE study examined the relationship between these experiences during childhood and reduced health and well-being later in life. Between 1995 and 1997, over 17,000 people receiving physical exams completed confidential surveys containing information about their childhood experiences and current health status and behaviors. The information from these surveys was combined with results from their physical exams to form the study's main findings. Almost 2/3 of adults surveyed reported at least one adverse childhood experience, and the majority of respondents who reported at least one ACE reported more than one ACE. 12.5% of the sample reported 4 or more ACEs. The ACE study looked at 3 categories of adverse experiences: childhood abuse, which included emotional, physical, and sexual abuse; neglect, including both physical and emotional neglect; and household challenges, which included growing up in a household where there was substance abuse, mental illness, violent treatment of a mother or stepmother, parental separation or divorce, or had a member of the household go to prison. Respondents were given an ACE score between 0 and 10 based on how many of these 10 types of adverse experiences they had before the age of 18. The ACE score was used to assess cumulative childhood stress. Study findings repeatedly reveal a graded dose-response relationship between ACEs and negative health and well-being outcomes across the life course. In terms of longevity, people with 6 or more ACEs died nearly 20 years earlier on average than those without ACEs. Let me repeat that. People with 6 or more ACEs died nearly 20 years earlier on average than those without ACEs. As the number of ACEs increases, so does the risk for a number of different diseases, and I'll give you just a few examples. Alcoholism and alcohol abuse, chronic obstructive pulmonary disease, depression, fetal death, drug use, ischemic heart disease, liver disease, poor work performance, financial stress, intimate partner violence, sexually transmitted diseases, smoking, suicide attempts, early initiation of smoking, adolescent pregnancy. Just to give you one more specific example, let's look at the problem of heroin addiction, what some are now calling an epidemic of our time. One study has estimated that 90%, yes, 90% of people with a heroin addiction have had early childhood trauma. From my own clinical experience, opioids, including heroin, are a soothing but ultimately destructive self-medication for deep, deep wounds. But how does this work? What are some of the mechanisms that we should be thinking about? Well, first we want to think about brain development. Remember that our brains aren't fully formed until we're age 25. So these events that happen before 18 are bound to have some sort of effect on the way that our brains, or maybe our stress response systems, develop. Second has to do with our stress response systems, and here I'm talking about stress physiology. If a child is often, or maybe always, in a fight or flight response, that's bound to cause some wear and tear on their bodies. It might also affect the functioning or the entraining of the immune system. And finally, it might have to do with epigenetics, not actually changing our genome, but changing which genes are turned on or turned off because of these early life experiences. Let's return now to our case of Miriam, where we learn that Miriam was exposed to a number of ACEs that might help us better understand her and what she needs to move forward.
I did have something I wanted to ask you about.
Okay.
I know they say that early childhood memories and experiences can scar you forever.
Okay.
And so I had some, and I'm wondering if there's anything that I can do about past childhood experiences. I mean, that was long ago.
Sure. Are you comfortable sharing what those experiences were?
Well, my father, he was an alcoholic. He died young. He was also sometimes physically abusive.
Okay.
And my brothers, I had sixes, but they got a little rough at times as well.
Okay.
And living on a farm, we didn't have any money. And so I got hand-me-downs from my brothers, to wear to school. And so that was an object of ridicule at school. Mm-hmm. So I'm wondering if there's something I can do to deal with those experiences.
Okay. Let me first say thank you for sharing those. I know even though it was a long time ago, it's sometimes hard to go back and pull up those painful memories. It can stir up a lot of feelings.
Yes.
So thank you for bringing that up. And you're talking about a category of events that now we call adverse childhood experiences, and it includes things like physical abuse, sexual abuse, poverty, drug abuse in the family, mental illness in the family, sort of all of those sorts of things happening to children, and the concern is whether or not, just like you said, sort of those experiences might affect those individuals even as they become adults. Mm-hmm. So you mentioned that your dad's alcoholism, his alcohol use disorder, mm-hmm. And that he was sometimes physically abusive. Oftentimes that includes sort of emotional abuse as well. Would you say that was part of it? Or?
That was,
okay.
Yeah. It wasn't always physical, it was emotional.
Okay.
Verbally abusive.
Okay. And your brothers, that was physical abuse or?
Well, just that I wasn't as tough as them. Not that they saw it as abuse, but I ended up black and blue,
right.
From clowning around, which was, yeah.
Okay, and how about your mom? Was your mom?
My mom was sometimes physically abusive, but not often. I mean, I think hers may have been from stress dealing with my father with his alcoholism and, my brothers, and it was a hard life on the farm. So I think hers was maybe out of stress.
Yeah.
But,
and you mentioned sometimes not having enough money or wearing hand-me-downs, and so were you ever like going to bed hungry or
Well,
not eating regularly?
We didn't have a lot. You know, we had the farm, so we didn't have extra to eat,
Sure.
certainly. And not hungry a lot, but some of the time.
Okay.
But it's just not, not good.
Okay, so there was some financial hardship for sure, but sounds like maybe some resourcefulness too of, living on a farm and making ends meet the way you can.
Right. I mean, you didn't necessarily like what you had to eat.
Yeah.
But you had something.
Miriam's story is not an uncommon one, and it reminds us about what may or may not be considered an ACE can sometimes be tied to context and sometimes to generational factors. Regardless, it's clear that Miriam was exposed to several ACEs: physical abuse, poverty, and a father with an alcohol use disorder. We know that she now has chronic obstructive pulmonary disease. She has high blood pressure, she has chronic pain, and she has generalized anxiety, all of which could in part be tied to her elevated risk caused by the ACEs. Now, we don't want to overstate the relationship and remember that chronic diseases are caused by many factors. On a psychodynamic level, it helps us understand what a complex and important relationship she must have had with her mother who recently passed away, the only other female in a household full of boys. Let's take another look to see how Miriam understood it and where we might go with this. You're right that when we do experience a trauma, especially as a child, depending on the severity and sort of extent of the trauma, we can carry it with us. Even if it's not a conscious memory, we can carry it in our bodies, where the body sort of remembers what it's been through, and it can influence the way we act with others. It can influence whether or not we trust other people or expect other people to hurt us, or if we make excuses for people that do stuff like that because we're kind of used to it. But there's a few surprising findings with adverse childhood experiences in that people who've had a number of those, and usually it's 4 or more adverse childhood experiences, they are more likely to smoke, they're more likely to drink, they're less likely to exercise, their risk for cancer is higher, their risk for cardiovascular disease is higher. So it really does seem like it influences our mood, so the risk for psychiatric disorders is higher. Depression's a good example. Risk for negative health behaviors is higher, and then of course all of the diseases that comes with that. So it's really been an eye-opener, I think, for a lot of people to realize that even though we make choices every day in what we eat or what we do or whether or not we smoke, these things have really deep roots sometimes. Even if it's not the level of, say, post-traumatic stress disorder, it can still subtly affect and change behavior.
Wow.
The good news is there's something we can do about it. And we can't change the past, right? And what's happened has happened, but through understanding it, through having that insight, and maybe, if necessary, processing and talking about some of those traumas, we're able to let go of some of that fear, able to let go of some of that anxiety. And you and I together have already been working on sort of creative solutions to help you exercise more, to have a healthier diet. And so despite all of the stuff that's happened in the past, there's a way to work around it. And it may mean it's a little harder to do that work, but it doesn't mean that you can't do it. And it doesn't mean that it's hopeless. It means that, okay, this is the load that I'm carrying. Maybe I can take some of it off and just leave it behind, but the rest of it, I'll hold it close. It's part of who I am, and I can still live the best life that I'm able. Okay, so why don't we explore the traumas a little bit more, see if any of them have enough of a charge that suggests we need to do some reprocessing, and if not, we'll just refocus on your health goals and make sure that you're as healthy as you can be.
Okay.
Okay. Now, a lot of the work that's being done in the area of ACEs focuses on early detection and prevention. Pediatricians and family medicine doctors are all over this. In fact, in the state of California, it's now mandatory to screen all kids for all ACEs and hopefully to connect them with services, although I think they're still figuring that part out. For Miriam or anyone over 18, prevention isn't going to help, at least not the prevention of ACEs. But remember that we still want to prevent additional trauma as an adult, and we want to minimize any maladaptive coping Things like smoking, excessive drinking, binge eating, high-risk sexual behaviors, or physical violence. Depending on the individual, we might also need to treat lingering post-traumatic symptoms, and here's where CBT again can really shine. I'd like to take just a slight detour and talk about a treatment called CPT, or Cognitive Processing Therapy. It is typically delivered by a mental health professional, often a CBT therapist, and it was designed for survivors of sexual assault. Given its efficacy with trauma in general, it's also been used for veterans and others with PTSD symptoms. It's typically delivered in 10 structured weekly sessions and makes use of the many tools already in our CBT toolbox. The This American Life podcast recently did an interesting piece on CPT. They followed a woman in treatment at the University of Washington with a therapist by the name of Deb Kaysen for 10 sessions in an episode titled 10 Sessions. Here's an example of a early homework assignment for this patient. What I want you to do is to write at least one page on why you think that the sexual assault occurred. I do not want you to think of this as an opportunity to write specific details about the event. This is more about writing about what you think caused the event. In this type of therapy, they typically use PTSD checklists, again as a form of self-monitoring, to track progress along time. They want people to think about how frequently have they thought about the trauma? How frequently have they dreamed about the trauma? How frequently have they relived it? In the past 24 hours, how often have they been disturbed by distressing thoughts about the trauma or unwanted memories that come to mind? Each question is then scored and summed over time, and they track that score. Stuck points are the first skill introduced in CPT, and they might be the most important skill of all. In a sense, the entire project of CPT is finding these stuck points and then learning how to unstick them. A stuck point is basically something that you hold up to be true, but might in fact not be true. A stuck point is a belief, and you should be hearing automatic thought, that keeps getting stuck because you have this traumatic memory. You're stuck in thinking that it's your fault. You're stuck in thinking there's something that you could have done to avoid it. You're stuck in any number of upsetting or inaccurate or harmful ways and remembering what happens. They track these stuck points, automatic thoughts, with what's called a stuck point log. Hopefully this is resonating with you now, and you can see how this is very similar to some of the CBT tools that we've used already. The thought record is the next skill introduced in CPT, but they use a different form called ABCD that really just creates 4 boxes on a page. The top left-hand box is A for the activating event, the sexual assault or whatever trauma happened. The bottom left-hand box is the B for the beliefs, and this is really just the automatic thoughts that we've talked about before. The top right-hand corner is the C for consequences, and here they mean the emotions or the behaviors that were stirred up because of those beliefs or automatic thoughts. The bottom right-hand box is the D, or the disputation box, and here is where you would write the new balanced thought, what would be column 6 in our 7-column thought record that you're already familiar with. In session, the therapist asks a lot of guiding questions to help a patient come up with those balanced thoughts for the D box. For homework, the patient uses the Challenging Questions worksheet, which just lists the same guiding questions that a therapist would use during the session. These are the same skills we used with thought records. Things like, am I looking at this in an exaggerated way? Am I looking at the whole picture? Am I basing things on facts or feelings? What are my habits of mind? At about this time, the concept of habits of mind is introduced, and they begin to name it to tame it. The process in CPT is all about finding and challenging those stuck points. Sometimes stuck points might be within stuck points. Often they're around blame, about not listening to a parent, about not being able to protect yourself, not being safe anywhere, or believing that maybe it was your fault because you wore something too provocative. Eventually, patients rewrite stuck points into a more balanced thought. They rate the believability both before and after the exercise to see if it was effective. This is really straight up CBT plus a little imaginal exposure and behavioral activation. Themes that often come up are around feeling safe, having self-esteem, or feeling in control. A sample stuck point might be, when I'm not in control, bad things are going to happen. And you would want to find counterexamples. A sample exercise might be to step outside and give and receive compliments to a complete stranger. This pushes against the social isolation that often comes up with post-traumatic stress disorder. And to give you an idea, you're close to session 10, what sort of last homework exercise would happen? The exercise would be something like this. Write at least one page on what you think now about why the traumatic event occurred. At this point, you might be curious or maybe a little worried about where you stand with your ACEs. You might already know that you've had several ACEs and you're eager to hear what you can do about it. But first, let's figure out your ACE score. I'm going to ask you 10 yes or no questions. You're going to get 1 point for each yes, so there's a maximum score of 10. Okay, here's the first question. While you were growing up, during your first 18 years of life, did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you? Or did they act in a way that made you afraid that you might be physically hurt? Answer yes or no. Question 2. Did a parent or other adult in the household often push, grab, slap, or throw something at you? Or did they ever hit you so hard that you had marks or that you were injured? Yes or no? Question 3. Did an adult or person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way? Or try to or actually have oral, anal, or vaginal sex with you? 4. Did you often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Yes or no? 5. Did you often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one there to protect you? Or your parents were too drunk or high to take care of you or to take you to the doctor if you needed it? Question 6. Were your parents ever separated or divorced? Question 7. Was your mother or stepmother often pushed, grabbed, slapped, or had something thrown at her? Or sometimes or often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or threatened with a knife? 8. Did you live with anyone who was a problem drinker, an alcoholic, or who used street drugs? Question 9. Was a household member depressed or mentally ill, or did a household member attempt suicide? And the final question, question 10, did a household member go to prison? Now, add up all the yeses, and this is your ACE score. Now, there are a few really important things to remember. First, ACEs are very common. In fact, most people have had at least one, and close to 13% of the population have had 4 or more. My ACE score was 3, so having ACEs is not a predictor of doom. Second, remember that the ACE survey only captures risk factors and doesn't assess protective factors at all. I had a solid handful of amazing public school teachers, church friends, and neighbors that provided a lot of buffering and a lot of support. Third, remember that these studies are correlations. They're associations only and are not proof of causation. Having more ACEs mean you might have an elevated risk, but it's not definite that you will get one of those many diseases in a long list, nor does it mean that your life expectancy just got cut by 20 years. Okay, with that said, I still think it is wise to step up your preventive health interventions if you scored a 3 or above. Let me give you a few examples of how this might work. First, you'll want a snapshot of your current health and wellness. Do you have high blood pressure, high cholesterol? Are you overweight? Are you a smoker? Look for those risk factors that might be telling you that chronic diseases are in your future. Now, we should all do this regardless of ACEs, but remember that ACEs increase your risk, so there should be even more motivation to do something. What are your health behaviors like? And here I'm talking about the usual list: diet, exercise, stress management, drinking, drug use, getting enough sleep. Remember that close social relationships are also key to being healthy and can have an important preventive effect. Again, especially important for anyone, but especially for us folks with 3 or more ACEs. Keep in mind that your risks also include things like depression and anxiety, both full-blown episodes, but also excessive amounts of the everyday stuff. A daily practice of something like mindfulness or yoga or running or prayer will be especially important for you. By now, I hope you're thinking about your CBT toolbox. Remember that both the cognitive and the behavioral tools target emotional regulation and social and occupational and physical functioning. We've already talked about how these tools can be used for depression, anxiety, and stress. The extra piece, the step further we need to go, is to think about how regulating our emotions with our CBT tools will influence our motivation and ability to engage in health-promoting behaviors. We need to specifically think about how a tool like a thought record or activity scheduling with pleasure predicting might help us get unstuck around starting an exercise routine or coping with cravings for sweets. In our next lecture, we'll do exactly that. We'll use our CBT toolbox to tackle health-related behaviors and behavior change in the context of chronic illness. But I'd like you to remember that these tools are also useful in preventing chronic illness, either the garden variety kind or the kind made more likely because of your ACE score. The bottom line is that there are things that you can do. You can knock down your health risks back down despite what may or may not have happened in your childhood. Break out those tools and put them to work. One of the best resources to learn more about ACEs is the CDC ACEs website. The URL often changes, so just type in CDC in ACE, ACE, into your search window. You'll see a list of studies, a summary of findings, and some resources for what you might be able to do next. Roll up your sleeves, and let's get to work. Thank you.